Our topic is the drugs used in anxiety and sleep disorder, benzodiazepine and non-benzodiazepine. In the anxiety and sleep disorder, the brain remains excited. That means the nerves or the neurons of the nervous system, especially brain, remain in a excited state. That means excited state means that the resting membrane potential of the neuron is about minus 70 millivolt. When the negativity within the neuron reduces, that means from minus 70 to minus 60, minus 50, minus 40, in this direction the cells get excited and there is the formation of action potential. And in the state of hyperpolarized state, that means from the minus 70 millivolt, if we can maintain the resting membrane potential at minus 80 or minus 90 millivolt, then it is very refractory to any stimulus and the brain remains calm and cool. I think it is clear up to this that the resting membrane potential is the factor or the pharmacological target of the drug of anxiety and sleep disorder. So, in this pathological state, the nerves get excited, the resting membrane potential is minus 40, minus 50, that means less negativity, and our target is to make the negativity, more negativity within the cell. That means minus 80 and minus 90. So how can we make this negativity within the cell? For this region, we have found that there is some channels within the cell membrane. If we can activate the chloride channel, and we know that the chloride ion is more in the outside. The concentration of the chloride ion in the extracellular fluid is about above 100 millimole per liter. That means 1.5 to 110 milli equivalent or millimole. And inside the cell it is 10 millimole or milli equivalent. So if we open the chloride channel by any means, it will produce a net effect that chloride will enter from the extracellular fluid into the intracellular fluid. Entering of chloride ion within the cell will reduce the will increase the negativity of the cell. That means chloride is a negative charge, and there is minus 70 millivolt in the cell. If more and more chloride accumulate within the cell, it will reduce the membrane potential from minus 70 to minus 80, minus 90. So how can we open the chloride channel? In the physiology, we have seen that there is a receptor, there is a neurotransmitter that helps this event of opening of chloride channel. There is a Gaba neurotransmitter. Gaba means the gamma aminobutyric acid. It is an amino acid that acts as a neurotransmitter, and you have learned that this neurotransmitter is inhibitory neurotransmitter. That means after releasing of this neurotransmitter from the presynaptic end, it will go to the it will process the synapse and ends with the binding of the receptor. This receptor is known as the Gaba receptor. We will show you the Gaba receptor. Here is the Gaba receptor. This Gaba receptor has 5 subunits: alpha, beta, and gamma subunits. Here is a site where the neurotransmitter binds, and there is a central channel of transmission of chloride ion, and this is the Gaba receptors. This Gaba receptors, opening of Gaba receptor causes the influx of chloride from the outside within the cell, and our target molecule binds here. So for the maintenance of the negativity within the cell, we can use a drug that binds with this GABA receptor and allow the receptor to open and entrance of chloride ion within the cell. It is seen that there are some chemicals like benzodiazepine and non-benzodiazepine that helps in opening of this chloride channel. So in our discussion, we have touched two general pharmacology topics like drug. What is drug? Drug is a chemical substance that modulate a physiological function or a pathological process. So this is the drug. And receptor. What is receptor? Receptor is a macromolecule or a complex of macromolecule to which drug binds to elicit their cellular or systemic response. These are two definitions of general pharmacology. In this case, our drug is benzodiazepine. It is a chemical substance and it has to bind with a receptor. The receptor is the GABA A receptor. This GABA A receptor, the benzodiazepine, this drug binds with this macromolecule GABA A receptor and elicit the physiological change. That means the opening of chloride channel. So our definition is the macromolecule complex that through which the drug binds and that elicit the cellular or systemic response. Here response is the opening of chloride channel. So benzodiazepine is the drug. It is a chemical substance and GABA is the receptor. It is a macromolecule or macromolecular complex. Here is a 5 macromolecule unite in the cell membrane to form a complex, and through this 5 macromolecule there is a chloride channel. So this is the introductory part of pharmacology, physiological basis of our pharmacology. Now we will move for the pharmacology of benzodiazepine.